This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, I'm going to be sharing my screen. Hey everybody. My name's Steven. I'm one of the PM&R residents from Johns Hopkins, one of the chiefs. I'm also joined by our other chief residents, which include Katie and Johnny. So as we're going here, feel free to ask questions in the chat because there's multiple of us. Oh, shoot. Let me do that. How do I share this? Oh, here we go. All right. All right. Hopefully everybody can see this.
Looks good.
Okay. Just not okay, here we go. So that's our infamous dome picture. It's the Billings building. And we work alongside we have a lot of history at Hopkins and really good medicine and a great place to learn. This is our program director, Dr. Friedlander. She's honestly one of the best parts of our program. Super nice, really emphasizes wellness and camaraderie, and really is a good leader to have. Katie and Johnny, feel free to chime in at any point. This is just some pictures of us. We every year at the beginning of the year we go to an Orioles game. They've been pretty good this year. Up at the top left, we have the graduating residents. Some have decided to stick around for pain and sports fellowships. And then we have some, we often have get-togethers, whether during didactics or also like extracurricular, just hanging out and having a good time. So we all enjoy being here. And I'm someone who had never been to Baltimore before, but definitely I would say is underrated. I feel like they always say up and coming, but I would say it is underrated. It is a little bit overshadowed by DC, but it is lots of good restaurants, cool places to go, nice scenery, and cool neighborhoods. Let's see here. Get the aquarium. Yeah, those are some of the main neighborhoods. We are a train ride to DC as well, and to New York. Not too bad if you want to get a weekend away. We have plenty of free weekends in PM&R, so it's nice. Let's see here. So these are our main rotation sites. All of them are within like 20, maybe 30 minutes tops of driving, which is pretty nice. We split time at both the main campus of Johns Hopkins and Johns Hopkins Bayview, which is more on the east side of Baltimore. We also have our pediatric rotations at Kennedy Krieger Hospital. Definitely one of our strong points. We have inpatient pediatric rehab rotation. Let's see, UMROI, or University of Maryland Rehabilitation and Orthopedics Institute. That is where a lot of patients come from shock trauma, and they need spinal cord injury rehab and traumatic brain injury rehab. So we rotate out there. We do a SNF rotation as well, or SAR, for patient or for people interested in going into subacute rehab. And then we have some various outpatient clinics that are not too far away from the city, but you do need a car if you do match here. As a disclaimer, this is more like an overview, and if you interview with us, and then we'll be able to give you a lot more information just about the program and more about the specifics. All right, so this is kind of a breakdown of PGY 2-year. So ACIR is what we call it here. Sometimes you just call it IPR, but acute comprehensive inpatient rehab. We have Meyer 7, which is at the main campus. This campus we get a lot more unique and complex cases. Let's see, and a lot of transplant patients as well. At Bayview, you have a bit more of the bread and butter rehab, stroke, brain injury, sometimes some spinal cord injuries at both places. At Meyer, you get a little bit more of cancer rehab too, because they have a cancer center associated with the hospital. And both campuses, they're connected. So if a patient has to be transported off, as it happens at anywhere, the patients don't have to call the ambulance. You basically just have to work on getting them transported within the hospital itself. Console rotations, I spoke a little bit about spinal cord injury already. In Baltimore, we do have a lot of that. Apparently, Baltimore gun violence has been actually going down. So that's I guess a good thing, but DC is going up apparently. So I guess we'll kind of stay tuned with that. But still get plenty of spinal cord injuries there. We have research elective, our PGY 2-year as well, and you have a couple outpatient months as well. It's maybe a little bit more outpatient than some other programs. Once we get to our PGY 3 schedule, it's a lot more outpatient. So 8 months here. Then we added a senior resident month, one of each for Meyer 7 and Bayview. And start to get some EMG experience as well during PGY 3 and PGY 4. And then 4th year, you have your TBI rotation at Umroy. And a newer thing is we added 3 total electives between PGY 3 and PGY 4-year. You can do those electives within our institution, or you can do them elsewhere. Dr. Friedlander, our program director, is very, very lax when it comes to gaining outside experiences. I would say one of the greatest strengths of our program is flexibility. And so with those electives, you're able to kind of focus on things that you want to do, whether it is continued research or more months in the pain department, as many of us are going into, or sports, or just at a different institution. So it's a little bit a convoluted slide, but this is Meyer 7, the main hospital. So there's 18 beds there, split between 3 providers. That would be the 2 junior residents and the nurse practitioner. Her name's Minnie. There is a senior resident who can help provide coverage as well if someone's out. But it's kind of a breakdown of kind of what happens. We do rounding. We have team meetings, see admissions and things like that in the afternoon. And then you sign out at 6, but most of the time you're done a little bit before then. So you don't have to physically be in the building until 6 p.m. But you just have to be on campus. In terms of for Bayview, we have Team A and Team B. This is a total of about 30-something beds, but you have 4 providers, two junior residents, and then 2 physician assistants. Let's see. So pretty similar kind of structure. Most of the time residents are nice to each other and let one person alternate who goes home earlier each day. But yeah, so usually in July it takes a little bit more work, like trying to figure out how to do things. Everyone's had an intern year already. So um, we've had a lot of the medicine. It's more about understanding rehab and figuring out how to do things here because oftentimes you switch facilities. In terms of call, we have two main call structures. One is the in-house call, which is usually during weekdays from 6 p.m. to 8 a.m. And on weekends, it's from 8 a.m. to 8 a.m. the next day. As with many other rehab facilities, there doesn't often be lots of acute emergencies, especially overnight. So most of us are able to sleep, even though we still get a post-call day. I was a bit hesitant when I was in your shoes. I remember doing PM&R Scholars back in the day too. And in-house call was a bit scary on paper, but it's a lot better than I expected. And oftentimes with home call, you don't get a post call the next day. So we all like our post call days a lot. In terms of the second R2 call, that one is basically weekend call. So you're rounding at Meyer 7, the main hospital, for basically the morning, maybe up to like early afternoon, for Saturday and Sunday. And then you're kind of back up for emergencies during the week if R1 is needs help. But that doesn't happen very often. It is kind of confusing. So you can save like detailed questions for your interviews, you interview with us. And then we have a backup call system where if someone calls out sick or something like that, we'll do that. I know we only have a few more minutes. In terms of the benefits, we have really great benefits. We have a House Staff Council that really puts in a lot of time advocating for us. So we've had multiple salary raises. I think we had a 4% increase this year, and a moving stipend added. We can take our vacation days any day we want, pretty much. We have the school holidays off. So we have a lot of scheduled days off, and then we have 5 additional conference days as well. In terms of educational stipends, we have $600 your PGY 2-year, $1,500 your PGY 3-year, and then $3,500 for your PGY 4-year. And then if you have publications, you get another $500 for each of the first 2, and then I think another $250 for the third one. So each year. So lots of great benefits here, good insurance, things like that. Didactics we have on Tuesday mornings from 8 to 1. So this was us at an adaptive climbing event. We basically go through every topic 3 times because we rotate monthly. So we have a lot of good lectures coming, and then if we have a 5th Tuesday in the month, then we'll do kind of an adaptive sports kind of educational thing, like how we went to the rock climbing facility, or like one time we've been hiking as well. We also have an ultrasound curriculum as well, which we work with Dr. Imam, our sports medicine fellowship director. And we have lifestyle medicine incorporated into our curriculum as well. And then our residents go all over the place for fellowship. It's a really important part, is having the Hopkins name and that using that as a tool for networking. So last year we had 5 residents match into pain. I myself am going into pain, and have plenty of interviews from that standpoint. And then Had some people going to pediatrics and brain injury. One stayed here for sports medicine. So really have a lot of great opportunities here, and looking forward to telling you more when we see you on your interview day. Katie, did you want to add anything? Or actually, there's one more slide.
I think kind of just to, I know that's like a lot of detail, and you're meeting a lot of programs. I think kind of one of the biggest takeaways is that we have a lot to offer here in terms of clinical care research. It's kind of really tailored to what you make of it and kind of what you want out of your residency. And usually the opportunities are there without issue. And like Stephen was saying, the flexibility with like kind of tailoring what you want your rotations to be. Of course, getting all the required, but it's really broad kind of range of training that is something that I really enjoy about our program.
5 minutes remaining.
Oh, nice. Okay, I thought we were closer to being done. All right, cool. Does anybody have any questions or anything about the program now? Feel free to use the chat too.
Yeah, there's one question about AI, virtual reality projects, research opportunities. I know for our didactics, we'll have some virtual reality kind of like Botox training type of thing. I'm not sure of any research. I don't know if Stephen or Johnny, if you know of any off the top of your head.
No, but I mean, our program is very willing to enable you to pursue basically whatever you want within reason. So if you are interested in that, I'm sure we could guide you to someone in that expertise of some sort. At Hopkins, we have research in pretty much everything, but I don't know any specifics on AI projects going on or VR. And then our next question is about the mentorship. So we do have a formal mentorship program. So we have residents from each class paired up with a faculty mentor, and we meet quarterly for that. And it's kind of like on the fly. It's not like super intense, but it's the same as our continuity clinic, which we didn't include as well. Our continuity clinic it's usually one day out of the month, but then during that day you work with the same people that are in your group, so you can kind of be a mentor to others, your juniors, but also you have a faculty mentor as well. Hopefully getting someone that is interested or doing the same thing as what you wanted to do. But we have a lot of people like interested in pain, so can't have everybody with our pain faculty. Do we have any IMGs?
One of our new PGY2s is an IMG.
Oh yeah, we do have we have an IMG, so we are friendly.
The lifestyle medicine incorporated into the curriculum. So we'll have a couple of days during our outpatient rotation where we can work on it, and our program actually provides like the I guess the program through the National Lifestyle Medicine curriculum. So you'll follow the online modules, and we do have some didactic sessions where they're kind of the application part of that curriculum. So our last one, we were virtual, and we had a couple residents cooking different meals, talking about nutrition, and applying it that way.
2 minutes remaining.
Awesome. And how do we like working in Maryland? I feel like I don't know. I've only worked in a couple different states. I'm originally from Florida. We take people from all over. So, yeah, no, I like Baltimore, and people are pretty friendly here for the most part. No, Baltimore gets a bad rep of I don't know, just crying and stuff like that. But If you avoid the bad areas and you don't stay out like super, super late, most of the time you're fine. Yeah. It's
Yeah.
much
Baltimore
better.
loves its neighborhood. Like, yeah, like they're pretty like, close knit. Like the neighborhood I live in, like I have a bunch of neighbors that like would drop anything to help me out, and they have in the past. Like, really just overall great community to live and to work in. So a lot of the residents live in the Canton area, or
conditions.
the Fells Point area. I
So
happen to live
postmodern
in
conditions.
South Baltimore, which I enjoy a lot. But I think those are kind of Canton's probably the one that we have most residents from. It's about like a 10-ish, 15-minute drive from the main campus.
Yeah, we didn't include our salary either. Our salary is so PGY4 is up to like 80,000 now, so it's much better than when we first started. I was looking at programs. I think the starting salary for PGY2 is I think mid-70s. It might be, not sure exactly.
Yeah, it's
Numbers though.
74,000.
Thanks, Johnny.
Thank you to Johns Hopkins for being on the call this evening. We appreciate having you.